Hi, my name is Claire Sinacori, and today I will be presenting on my doctoral capstone experience titled Occupational Therapy's Role in Older Adults with Low Vision. This capstone centered around two ACO concentration areas, that being advanced clinical practice skills and program development. The target population was older adults experiencing low vision, such as conditions including macular degeneration, glaucoma, diabetic retinopathy, or other visual field deficits. I worked under the mentorship of Christine Below, who has over 12 years of experience practicing low vision OT and is the sole operator of Visible Solutions. Visible Solutions is considered an outpatient OT service, but the sessions were provided in the client's homes around the Kalamazoo area. This project sought to address the gap of limited awareness as well as accessible education in low vision OT, as it is an underrepresented area of OT. The objectives of the project were to gain advanced clinical practice skills regarding low vision OT evaluation and intervention, as well as develop resource and tools specific to the site needs that will be covered in further detail later on. This project not only benefited the site, but also contributes to the field of OT by highlighting the critical role of OT in low vision, while also providing tools and resources that can be used in not only low vision OT, but across practice settings. A literature review was completed before the 14-week capstone experience, and it provided a review of the current research, but as well as guidance for the clinical practices in low vision OT. Low vision significantly affects older adults and it impacts their independence as well as their daily function. OT plays a large role in helping individuals participate and engage in meaningful occupations by addressing their goals and providing assessment tailored intervention as well as education that aligns with their visual abilities. As far as intervention, for reading and writing, strategies include eccentric viewing training or teaching them how to use their best vision, the use of magnifiers, enhancing the lighting, as well as increasing contrast can all help. For ADLs and IEDLs, this might include introducing adaptive tools such as large print calendars, a liquid level indicator, or a simplified and large button TV remote. The environment could also be modified, for example, placing high contrast tape on the stair edges, reorganizing cluttered spaces, or adding tactile markings on kitchen appliances like microwaves and ovens. Technology is also a major tool. Clients can be trained to use electronic magnifiers, use screen readers, most recently AI glasses, but also how to use and incorporate accessibility features on their computers, tablets, and their phones, as well as using helpful apps. A needs assessment was conducted to guide this project with the site mentor, a current low vision client, as well as a key stakeholder in the low vision community. This allowed us to pinpoint the gaps in OT services or other supports. There were key themes among both the challenges and opportunities. A major challenge was, once again, that lack of awareness, and this is for both the general public, but also healthcare professionals regarding what occupational therapy can offer for low vision. And this also plays a role into the limited access of services. The low vision client reported feeling frustrated after their diagnosis in regards to the education provided, as well as the emotional support following their vision loss. So, opportunities became clear for the site desired accessible educational materials, an updated electronic evaluation form, as well as the establishment of support groups that they could offer their clients, because most of them were shut down since the pandemic in 2020. And then this information was used to focus the project as well as create the objectives. So, moving on to the objectives achieved during Capstone, the first and second objective focus on deepening my knowledge in low vision condition as well as the clinical practice skills in low vision OT, such as evaluation, assessment, and intervention. A lot of time was spent collaborating with the site mentor to and treating clients firsthand. The time spent on these objectives directly affected my ability to meet my other objectives. I aim to create at least 5 educational handouts, for the clients and caregivers, but I exceeded this goal about 2 times over. The topics of these handouts were determined based on the needs of the clients that we were seeing, as well as common areas that often required, further education. This included, topics such as how to use electronic magnifiers, how to use the Seeing AI app, writing tips, or steps on the accessibility features of, their technology. All of these handouts were created using accessibility features such as at least size 15 font, high contrast, simplified sentence structure, as well as using the font Lucille, which was found to be a preference of people with vision impairments, and it was designed as such. Um, for the next objective, I created a new electronic modifiable evaluation form to improve efficiency with documentation. And this was done in collaboration with the site mentor to make sure it followed the flow of her evaluation style, as well as to ensure long term sustainability. Objective 5 was achieved through the organization of all the handouts that were created, as well as the different resources that were gathered throughout the 14 weeks, all put together in a digital repository. The site has access to this and then has the opportunity to keep expanding its content. And then finally, the development of the low vision support groups was a major focus and was established at 3 different retirement communities around the Kalamazoo area. I created a marketing flyer, an outline of 7 meeting topics, and 3 accessible PowerPoint presentations for the first 3 meetings. I helped run 5 sessions by the end of the experience, and the site mentor is going to continue facilitating these meetings for the foreseeable future. For the implications of the capstone, the project impacted both the site and the low vision community it serves. For individuals with low vision, appearance and presentation is very critical when learning. So the accessible handouts helped reinforce that education that was provided during treatment sessions. And this experience also allowed the site to refine their instruction method during treatment so that the training that was provided was then cohesive with the handouts that were provided. In regard to the support groups, they provided a meaningful space for awareness, education, and emotional support. It created a place to address the challenges associated with low vision, as well as connecting with others going through the same thing. We found that it became a platform for residents to share their thoughts on changes they'd like to make to their own communities that would make it more accessible, like large print menus or announcements and calendars for activities. Finally, the sustainability was a key factor in the project. So the evaluation form, as well as the digital repository filled with the resources, are in place for the site's continued use. So, in conclusion, I've significantly increased my knowledge on low vision OT practice skills through the direct client interactions as well as the guidance and knowledge of my site mentor. And for the site, they've received streamlined documentation through the evaluation form, as well as accessible educational handouts for the clients, as well as the comprehensive toolbox in the form of the digital repository. And then the 3 support groups that were established not only strengthen the connection between the participants, but with the site and the community that it serves. And then on the last slide here is an example of some of the handouts that were created. On the left here, it is an example of an electronic magnifier step-by-step guide, that being the Ruby. In the middle, you will see the low vision flyer that was made for the support groups. And then finally on the right, that is an example of one of the pages in the Seeing AI app step-by-step guide. Thank you so much for listening to my presentation.